at 20 feet, the smallest letters that a child can read is 20 by 60. So 20 feet is equal to 6 meters. ठीक है? 20 feet is equal to 6 meters. So the visual acuity of this person is 20 by 60. This child has having a visual acuity 20 by 60. While the normal is 20 by 20, which is equal to 6 by 6. It's a paired sinus, largest sinus, which is connected by the transverse sinus. So in US, we take it as 20 by 20 foot. In India, we take it as 6 by 6 because in India, we are taking this distance in meters. In US, we are taking in foot. This is in foot and this is in meters. This is in meters. What is the name of the chart, guys? Anybody who will be taking your Viva will ask you first the name. What is the name of this chart? It is the Snellen's chart. So when this child is standing at a distance of a 20 foot या फिर 6 meters पे, he is not reading all the lines. He is just, child is reading up to 20 by 60. So 20 by 60, if you compare by 20 by 20, so it is actually 1/3 of the normal. 20 by 60 is 1/3 of the 20 by 20. ठीक है? That means the person is seeing the larger letter. Larger letter means he requires larger angle. It is like this. And this is your lens and this is your nodal point. Nodal point, that is the center of the lens. So this child is actually seeing the larger letter. So as you go nearer to the letter, you are seeing the larger angle. That means if this child wants to read 20 by 20, he has to come closer. He has to come closer. Kitna close आना पड़ेगा? Because the visual acuity, if you read the question, they say you have the child walk towards the eye chart, how far she should walk so that she can see 20 by 20 line. Now, because her visual acuity is 1/3, so she requires 3 times the minimum angle of resolution. What is minimum angle of resolution? 5 minutes of the arc. She requires 3 times. Now, as you are coming closer and closer to the letter, the size is increasing. So, for 1/3 visual acuity, she requires 3 times the minimum angle of resolution. Therefore, should stand at 1/3 of the distance. So basically, she should stand at 1/3 of the distance so that angle becomes 3 times. So 1/3 of the 20 foot is approximately 7 feet. Approximately 20 feet ka 1/3 is 7 feet. And she is standing at 20 feet. So how, and she has to stand at 7. So how much she should walk anteriorly? That is 13 feet. How much she should come anteriorly so that she starts seeing? She has to come 13 feet so that she stands at 7 feet and then only she can see. So answer is not 7 feet actually. Answer is 13 feet. She has to come 13 feet towards the letter. Only then she will be able to see. Yes. Please see the spelling of Snellen's chart. Nobody is going to ask you, but you should know the correct spelling, guys. Snellen's chart hai. Snellen's chart. And see this also. How much she should walk anteriorly. How much she should walk anteriorly? She should walk anteriorly about 13 feet. Only then she will be able to see it. So I think you have understood this. Today we have discussed the case of optic neuritis, paralytic squint. Then we have discussed the question related to the anatomy, cavernous sinus, along with the visual acuity. 4 very, very important topics, because optic neuritis, usually we get questions from the medicine, then a squint question, then a visual acuity question, and a diagrammatic image-based anatomy question. So I hope you liked it, you have understood it. Keep on studying, remain tuned, and next week again I'll be coming with more of clinical case discussions. Take care guys. Happy ophthalmology. Bye bye.